everyone, it's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head and Neck Surgery. Attention, all underrepresented in medicine applicants to otolaryngology. September 1st is rapidly approaching, and you will have the opportunity to submit your ERAS application to your selected programs. Even though most otolaryngology applicants typically submit their ERAS to 60 to 70 programs, I'm going to share a perspective an underrepresented in medicine applicant might consider. But first, as a reminder, the process is also for you to identify a program where you will thrive in your residency training. Tip number 1, when you are reviewing program websites, you may not see images of faculty and residents that look like you. This does not mean, however, that the program is not genuinely interested in trying to diversify our specialty. Look through the website and try to identify programming where the department has taken action to try and attract underrepresented in medicine applicants. For example, the department may offer a specific research opportunity or rotational experience for an underrepresented in medicine student to gain exposure to that department's program, as well as work with various faculty and residents. Tip number 2, you really want to ask yourself, does the institution as a whole support the acceptance and the graduating of competent underrepresented in medicine residents? Check and review the graduate medical education website at the institution you are considering. Does the GME mission include diversity, equity, and inclusion? Does that website offer specific initiatives for diversity, equity, and inclusion at that institution? It might also be instructive to glance over the web pages of other surgical programs at the institution to see if there are universal efforts across the board in each department. Tip number 3, take advantage of the fact that due to COVID, last year's match cycle resulted in programs embracing the use of social media as well as augmenting interaction with residents and faculty through virtual events. You can still view and listen to many recordings from last year because many are still available online. You will see for yourself the nature of the interactions between the residents and faculty, and between the participants and the program. Ask yourself, did those interactions appear to occur with ease or not? There may be subtle findings here that may suggest one program's potential for a better experience in your training over another. So much to consider, but purposeful research is the name of the game. If you find my tips helpful, share them with your friends and continue to follow me at Dr. Gina Joe on Instagram, YouTube, and Twitter.